So the question that I raise is, why is it that a cell designed for therapy is more torturous than a cell designed for punishment? I'm presenting on the nature of mental health care for women in New York State prisons. Why I chose to focus on women is because they have unique issues. Currently, they are the fastest growing prison population. They have higher rates of mental illness than men, and they are often victims of sexual abuse prior to prison and during prison by prison guards. Although the nature of mental health care is common among both men and women in prison, there's a greater concern for women because biologically, women are shackled while pregnant. They are shackled during labor, and they're also shackled immediately after giving birth. Sociologically, they are sole providers of at least one child, and they are often victims of sexual abuse. Psychologically, 10% of the female prison population is diagnosed with a serious mental illness in comparison to 4% of men. The shoe exclusion law. The shoe exclusion law is a law that was enacted in 2008 that says that any person with a serious mental illness should not be in solitary confinement. They should be diverted to a therapeutic unit so that the behavioral issues associated with their diagnosis is treated as opposed to punished. Since the enactment of that law, New York State Office of Mental Health, OMH, which I'll be referring to often, and Department of Corrections, DOCS, have created worse conditions, confinement, and treatment on therapeutic unit more torturous than SHU simply because they cannot keep up with the demand of people with mental illness. There are only 3 female prisons: Bedford Hills Maximum Security, Albion, and Taconic medium facilities. Every woman who is transferred from jail to Bedford Hills Reception Center, the reception unit, they are assessed for their mental health status. Mental health status level 1 is for serious mental illness, which is schizophrenia, bipolar, schizoaffective disorder. Levels 2, 3, and 4 is for a less severe mental illness, like personality disorder, adjustment disorder. There is no level 5, and level 6 is for women who is not in need of mental health services at the time. However, any woman at any time could access mental health services. Currently, there's more than 50% of the female population, prison population, on the mental health caseload. Since the enactment of the shoe exclusion law, OMH has changed the diagnosis of over 52% of the prison population. So between the years of 2008 and 2017, what we see is a decline in the patients diagnosed with serious mental illness. And during those same years, we see an increase of patients diagnosed with adjustment and personality disorder. So what that means is that a person who was previously excluded from going to SHU and had a diagnosis like schizophrenia, OMH changed their diagnosis to something like personality disorder, so they now become eligible for SHU, solitary confinement, 23 to 24-hour lockdown. Simply because OMH has no room for adequate therapy. There's multiple therapeutic units that I'll discuss later on. One of them is the ICP unit, which is Immediate Care Program. The women housed here are diagnosed with serious mental illness, and they are unable to function in general population, and they are simply there awaiting transfer to Central New York Psychiatric Hospital, which is an inpatient hospital located outside of the prison. And since there's so many people suffering from mental illness that's on the waiting list, the women there are waiting for months when it should be days. Also, women diagnosed with levels 2, 3, and 4 are having an individual therapy substituted for group therapy. These group therapies are held once a month for 30 minutes, ranging from 5 to 15 patients at a time. Women experiencing mental health crisis are transferred from RCTP to SHU. RCTP stands for Residential Crisis Treatment Program. Women there are experiencing a mental crisis, and there are 2 units. There's a dorm area and there's a cell area. And from the years of 2007 to 2016, we are seeing a 68% increase in their admissions to these units. Also, in the years of 2011 to 2015, there were over 1,000 additional discharges to the SHU than there were admissions from them units. So what that means is that it was easier for a woman in mental health crisis on a therapeutic unit to be transferred to SHU, but it wasn't as easy for a woman in SHU to be transferred to a therapeutic unit. And so when women are forced into SHU, the suicide rate goes up. The number of incarcerated people on therapeutic units that attempted suicide between the years of 2008 and 2017 was at a 70% rate. Could you imagine if 70% of the people in this room attempted suicide, what that energy would feel like? The level of suicide is higher on therapeutic units simply because OMH intentionally creates a punitive environment on these units because there are more beds in SHU than there are on therapeutic units. And there are more people suffering from mental illness than there are violent felons. Women in RCTP or observation cell versus women in solitary confinement. As I stated before, RCTP has 2 units, a dorm area with 12 beds and a cell area with 5 beds. And solitary confinement has 48 beds. The RCTP unit's purpose is for therapy and mental stabilization. And solitary confinement purpose is for punishment and mental anguish, mental abuse. So the question that I raise is, why is it that a cell designed for therapy is more torturous than a cell designed for punishment? And I attempt to compare and contrast the two. So if we look to the left, that is a representation of what an observation cell, a woman in an observation cell looks like. And to the right is a representation of what a woman in a solitary confinement cell looks like. So a woman in a solitary confinement cell is confined for 23 to 24 hours a day, which means that she has an option of having an hour of recreation. A woman in an observation cell, she's confined for 24 hours a day. She does not have the option of outdoor rec. A woman in a SHU cell, solitary confinement, she is given limited amount of property: books, pen, pad, clothes, underwear, shoes, socks. A woman in an observation cell is stripped. She has none of that. She doesn't have any clothes at all. She doesn't have any pen, any books to take her mind away. She doesn't have any underwear, no socks, no shoes, no bra, nothing. She is naked underneath a padded smock that's shaped like a dress to prevent her from harming herself. Women in solitary confinement are given utensils. Women in observation cell is without utensils. They are forced to eat with their hands. A woman in a solitary confinement cell and a woman in an observation cell can shower Monday, Wednesdays, and Fridays for 5 to 10 minutes at a time, depending on the guard. A woman in a SHU cell can brush her teeth every day, even though it's with a dual toothbrush the size of a ballpoint pen. She still can brush her teeth every day, while a woman in an observation cell can only brush her teeth Monday, Wednesdays, and Fridays. And she has to ask the prison guard for toothpaste, which she places on her hand. She's not given a toothbrush, so she's forced to brush her teeth with her fingers. A woman in a SHU cell is not under surveillance, while a woman in the observation cell is. And a woman in an observation cell, when she's menstruating, because she doesn't have any underwear, she's forced to hold that pad to her private area, and she's exposed by the camera the entire time. What's supposed to happen versus what actually happens? Well, actually what's supposed to happen is there are policies and procedures in place that states that even if a woman had attempted to commit suicide, she is not to be stripped of certain amenities. At bare minimum, she's supposed to be given eating utensils, underwear, pajamas, and writing materials. And only if she's in that cell and she tries to harm herself is she to be stripped from these amenities. And when she is to be stripped of these amenities, OMH is supposed to make proper documentation. Research has shown that OMH is not properly documenting reason for denial. And if they are documenting the reason for denial, the documentation is illegible. And if the documentation is legible, there is no signature, or the signature is illegible. In conclusion, Since the enactment of the shoe exclusion law, all major docs have failed to provide adequate mental health care for women. As a result, women are at a higher risk of suicide than they are successful reentry, and therefore prison health must be seen as a public health issue. And so the solution that I propose is that since biologically, sociologically, and psychologically, these issues are going to continue to exist amongst women, women prison should be abolished, and the cost of incarceration should be allocated to diversion programs, community mental health treatment and therapy, and substance use and treatment. Thank you all for your time.